So today we're drawing your blood to do some lab tests, and we're going to check your cholesterol. And so I want to go over with you some of the common lab values and what our goals are for cholesterol and a couple of other labs. Is that okay?
Perfect.
Okay. So total cholesterol, we like that number to be less than 200. And then there are two other types of cholesterol. One is the good cholesterol and the other is the bad cholesterol. You've heard of good and bad before, correct?
That's right.
So the bad cholesterol is LDL cholesterol, and that cholesterol lays down the plaque in the arteries and increases our risk of having heart attacks. So we like that number to be less than 100. Now, if you're diabetic, though, the goal is less than 70. We have to work even harder, okay? Now, HDL, which is the good cholesterol, we want that to be greater than 40. We want that number to be higher because it helps clean out the arteries and decreases our risk of heart disease. Other numbers that are important to go over, triglycerides, that's kind of a measure of how you're doing with your diet. I kind of call it the fat floating around in the bloodstream. It can be high sometimes from eating too many refined sugars or carbohydrates. That number we like to be less than 150. Other numbers that are important are your blood sugar, in case you have any family history of diabetes or we're worried about you being pre-diabetic. Blood sugar when you're fasting, we'd like it to be less than 100, and if you're not fasting, our goal is for it to be less than 140. Sound okay?